Again, can you look to the left? Up, down. Here on the south side. Up and down. Okay. And this is my thumb. If I say look at my finger, go straight to my finger, go to my thumb. Okay, ready? I look at my finger. Look at my thumb. My finger. Just your eyes. Look at my thumb. My finger. Look up and look down. Steady. Now look a little to the left. Check for nystagmus. Now to the right, a little to the right. Now, can you look to your right? This is to remove fixation. Okay, can you look straight? See if we can induce any nystagmus. So keep looking straight.
After checking for central facial weakness, dysarthria, dysphagia, dysphagia, proceed to do other tests to differentiate central from peripheral causes of dizziness and vertigo. Check for subtle weakness doing the pronator test. Make sure and check for a drift on one arm may indicate an upper motor neuron lesion. And an alternative test or a complementary test would be to do a Li-Barnes arm roll. Again, you want to see a delay or slowing on one side. Cerebellar testing is very important as cause for dizziness, so perform a finger-to-nose test on both sides, the left and the right, and see if there would be dysmetria. The other one is doing an alternate supination, pronation test of the hand and see if there would be any ataxia to suggest a cerebellar lesion. A neuro exam is never complete until you see the patient do a walk, but then after a regular walk, do the tandem walk. If you see ataxia, that can be suggestive of cerebellar lesion. In doing the Romberg's test with the patient standing still, if there is marked swaying on closing the eyes compared to when the eyes were open, check for posterior tract lesion, neuropathy as the cause of the imbalance or vague complaint of dizziness or vertigo. In the sharpened or tandem Romberg test, the patient is asked to place her feet in a heel-to-toe position with one foot directly in front of the other. If there is much swaying or fall, this may suggest a vestibular impairment. Don't forget to test for hearing, especially for those with acute hearing loss, by using your tuning fork, or if not available, just scrubbing your fingers on both ears and comparing whether the patient can hear equally on both sides. If you are entertaining posterior canal BPPB, then do a Dix-Hallpike test, and if this is positive, proceed with the Epley's maneuver. However, because of due to limited office space and one cannot do the Dix-Hallpike, you can do the Simon's side-lying test. And if this is positive, do the Simon's liberatory maneuver. See other videos on these procedures.